Did you know that Naloxone saves 3 lives a day? Stay tuned to hear more. Australia's free Naloxone program is saving lives every day. But critical gaps in frontline access could leave overdose victims waiting when speed is everything. Today, we'll dive into how Naloxone works, what Australia is doing right, and where the policy gaps are costing precious minutes. Each year in Australia, more than 1,000 people die from opioid overdoses. Most of these deaths are accidental, and many happen in private homes, and nearly all could be prevented with timely intervention. Naloxone is the key. Naloxone is a fast-acting medication that can reverse an opioid overdose before it becomes fatal. Think of it as a blocker. It kicks opioids off the brain receptors and buys critical time for emergency care. When someone overdoses on opioids, breathing slows or stops. Naloxone restores breathing by reversing the respiratory depression caused by the drug, the opioid. And effects start within minutes, and it's incredibly safe. Even if given to someone not experiencing an overdose, it won't harm them. Naloxone can be given by nasal spray such as Nixoid or by injection such as Prenoxad. For people without medical training, the nasal spray is the simplest option. It's quick, there's no needles involved, and it is designed for use by anyone, including family members, friends, even strangers on the street. The World Health Organization recommends that anyone likely to witness an opioid overdose should have access to Naloxone. Studies show it's one of the most cost-effective interventions we have for reducing overdose deaths. In North Carolina, for example, counties with community Naloxone programs saw a 14% drop in opioid deaths compared to those without. Every dollar spent on Naloxone distribution saved multiple dollars in healthcare costs and preserved lives. Now, Australia has embraced the evidence, and the take-home Naloxone program now offers Naloxone free of charge without a prescription across the country. It's available through pharmacies, participating pharmacies, and drug treatment centres, needle and syringe programs, custodial release programs, and vending machines. The federal government committed $19.6 million over 4 years to make this happen. It is a major public health investment, and it is working. Recent research from the Monash Addiction Research Centre shows that more than 60% of pharmacies now stock take-home Naloxone, and this is a big jump from just 23% in 2016. Pharmacies providing opioid agonist therapies like methadone are even more likely to stock it. Furthermore, we now have Australian evidence that if take-home Naloxone is freely available in the community, it saves 3 lives a day. But not all the news is good. So almost 40% of pharmacies still don't supply Naloxone, even when it's available. And not everyone who is at risk knows that they can get it, or even thinks that they need it. So a South Australian study found that many people at risk of either witnessing an opioid overdose or experiencing an opioid overdose, don't access Naloxone because they don't believe that they were at risk of overdose, or they didn't know that they could access it for free. And so here is a major education gap that needs closing. Meanwhile, new threats are emerging. So highly potent synthetic opioids like fentanyl and nitazines are starting to appear in Australia's illicit drug supply. Nitazines are particularly dangerous. They are many times stronger than fentanyl, and an overdose can cause respiratory arrest in less than 30 seconds. This raises the stakes enormously. If Naloxone isn't immediately available and administered without delay, there is little chance of saving that person's life. Which brings us to Victoria. Victoria has been a leader in harm reduction, offering free Naloxone through community channels and pharmacies and supporting supervised injection facilities. But strangely, Victoria Police, the first responders often arriving at overdose scenes, are not allowed to carry Naloxone. And this policy disconnect is puzzling. Everyday citizens are encouraged to administer Naloxone if they witness an overdose. Outreach workers can carry it, even vending machines can dispense it. But trained police officers, they are barred from using it. In fact, Victoria police officers, PSOs and custody officers must be first aid certified yet they are specifically forbidden from carrying or administered naloxone unless they are medically trained paramedics. Compare that with Queensland, where police officers have been trained and equipped with naloxone, or Western Australia, where similar programs are underway. And it wasn't always like this. In 2018, Victoria Police carried naloxone and used it often. One report said that they responded to so many overdoses overnight, they had to restock in the morning. So why the backflip? Well, part of the reason may be legal uncertainty. A 2024 report highlighted a bizarre double standard. Untrained bystanders can legally administer naloxone immediately, but trained frontline workers like outreach staff may face legal and insurance risks if they do it without first calling 000. One nurse outreach worker shared that she had to spend 2 minutes on hold with emergency services while a person overdosed in front of her. 2 minutes. That's enough time for a brain to be starved of oxygen, causing permanent damage or death. Legal experts point out the absurdity. We trust the public to act in an emergency, but hesitate to trust trained workers and police officers to do the same. The Department of Health advice compounds the problem, warning that workers may not be covered by indemnity insurance unless they call emergency services first. This fear of litigation creates deadly hesitation. Meanwhile, naloxone supply pressures are also building. Some formulations, particularly the nasal sprays, are facing shortages. The Department of Health is working with suppliers to address it, but limited stock can seriously undermine availability when it's most needed. At the same time, public perception lags behind reality. Many opioid overdoses involve prescription medications such as painkillers, opioid-based painkillers, not heroin. People using codeine, oxycodone, tramadol, or even morphine for chronic pain may not realize that they are at risk. Friends and family might witness an overdose at home, not in a back alley. And this is why naloxone needs to be normalized, not just for people who use drugs, but for anyone prescribed opioids or living with someone who is. Imagine if every person picking up an opioid prescription was automatically offered naloxone with a simple explanation. This is a safety device. Like a seatbelt, hopefully you'll never need it, but if you do, it could save your life. That is the culture shift that Australia needs. Back to Victoria. The refusal to allow police officers to carry naloxone stands out starkly. In the words of David Ettershank, speaking to Victoria's Parliament, frontline emergency workers are those most likely to be there when lives are on the line. Why are we tying their hands? That's a very good question. Harm reduction leaders agree. They call Victoria's position mind-boggling, especially as synthetic opioids drive faster, more deadly opioid overdoses. Victoria has 24/7 naloxone vending machines, free naloxone at pharmacies, and a major public health investment in harm reduction. But without equipping police, we leave a critical gap open. So what is the solution? First, update Victoria Police policy to allow officers to carry and administer naloxone without fear of reprisal. Second, provide clear legal protections and insurance coverage for outreach workers and frontline responders using naloxone in good faith. Thirdly, improve public education about who needs naloxone and how to use it. Fourthly, push for 100% pharmacy participation in stocking naloxone under the national programme. And fifth, address supply shortages urgently to avoid access gaps. Australia has shown that public health programs can save lives when they're backed by good policy and proper support. The take-home naloxone program is a proven success story, but it's only half the job if frontline responders are left standing by. The stakes are rising with synthetic opioids. Seconds matter. And fixing a few simple policies could mean thousands more Australians living to tell the tale. That's all for today, folks. My name's Dr. Ferghal Armstrong, and this has been Cracking Addiction.